right, good evening, everyone. Sorry for the delay. Today is the Tuesday, September 28th. It is now 6:28. We've had some technical difficulties prior to the meeting starting. I would like to call the Board of Health meeting to order. And looking at the, we don't have any minutes to approve. I'd like to get right into a well irrigation request at 6 o'clock for, well, it's going to be at 6 o'clock for 718 Oxford Street South.
Thank you. So the 718 Oxford Street South, we have the plan here. This particular property does have a septic system repair as of last fall. So we did approve a plan. There is a existing house. A septic system was proposed and actually has been installed. During the process of this happening, there were some issues that occurred with the existing well. It's an existing shallow well. It's actually very well built. It has a structure around it and is enclosed. When you open up it's essentially a hatch, you can look down into about a 14-foot depth open well supplied by groundwater. This particular well, the property owners have had some issues with, and they have decided to drill a new well, and that new well is in the front yard. So that process has gone forward. However, they would like to keep the existing well for irrigation purposes. They do have a large parcel. They would like to keep it for the purpose of irrigation of their lawn and some vegetable gardens. So that is the status of the current request. In the past, we have taken requests for irrigation wells, and I'm happy to answer any questions regarding that. I have spoken with the property owner, even as of yesterday. They were going to try to attend the meeting, but they weren't sure they could.
Okay. I do remember having requests like this before the board as well. I don't believe we've had any problems with that. You don't see any foreseen? This particular shallow well is very well covered, and we have allowed it in the past. You know, they are willing to test it if needed, but I don't recall that we required testing for irrigation wells. Okay.
Okay. So I'd like to make a motion to allow the irrigation request of the well at 718 Oxford Street to be approved.
And I will second that motion. And all those in favor signify by saying aye.
Aye.
Aye. All those opposed? No one opposed. It's approved. Thank you.
Thank you. I'll just let them know, obviously, that they are not going to be using it for water.
Okay.
Thank you.
Thank you. And then next agenda item is a COVID update and mask order discussion. So I guess I'll start this off, as I was made aware of this. We did not have a meeting last week, that there was a concern at the town administration level in regards to increasing numbers of cases, in particular those of breakthrough cases within some town departments, which had promulgated some discussion on possibly mandating a mask mandate in all public buildings, which two departments had voluntarily been doing over the past week. So what we have before us this evening was a mask order put together by town administration for all public places, public buildings, municipal buildings.
Municipal buildings.
Yep, municipal buildings. Be clear on that. Yeah, did you have anything else to add?
So I know that the library director, Jean Collins, is on the line, and she may have some input. But the discussion about this has kind of evolved over the past several weeks. And kind of the reasoning for it is that we have seen a number of municipalities starting to look at this. Municipalities have put some mask mandates of some sort into place, whether it's just municipal buildings or the entire town for public areas. And with the case increase, Eileen did spend a good amount of time to put the cases together for you, just so you could kind of see, how there has been an uptick. We have had some town departments that we've had to address some COVID cases. So just wanted to kind of bring it to your attention. We included the cases increased since May, and then we also have the information regarding vaccinations, because I know that usually goes hand in hand, for what the town vaccination for Auburn. So currently, as of last week, with the latest state report from Mass Department of Public Health, we have a 68% vaccination rate total for the town. And we do have, as you may recall, we did offer vaccinations for our first responders early on, and we have had vaccine clinics for the amount of vaccine that we could early on as well. We do have a lot of employees that have gotten vaccinated voluntarily. The town does also have some incentives that they're working on for vaccination of employees. That has already begun. Town administration has been working with human resources, and we've already started the program. Some things such as tickets to local events. There's also been some discussion about getting some time off for anybody that becomes vaccinated. So there's a lot of incentives for employees.
I think one of the things that I would like, and I believe I spoke when I was with Eileen and you folks, is this is the report of how the town is doing, but we're looking at it for municipal buildings and stuff. I would want to know where we stand with per department vaccination rates, and I know that we can't get that data now, but now that they have this incentive program, there's something that we can begin to get a data set on that. And I think moving forward, that would be important. I think you need to know where people stand as far as that. Not individuals, but just departments, percentage of employees.
We do have a high percentage.
Good.
For this part of it in this building. I think the library does, the senior center does, I think the fire department does. I think there's departments that do have a higher percentage. I kind of went through who I knew, because we did a lot of the vaccinating,
right.
And who I knew just from tracing. There are some departments that I put feelers out there, and again, they're collecting their cards and don't really have a full grasp of it. The people didn't necessarily have to give their card until they take the day, so they're starting to collect that data, and it's not all in, but
okay.
We do have a good grasp that we do have a high percentage. We feel even once we put it all together that our percentage will be decent, but we still would like to. That's our incentivizing is to get as many people that really
Gotcha. Okay.
want it.
Yeah, I don't have any questions. I read this. I've seen other, private businesses doing this in town as well. And I think my biggest concern was there was breakthrough cases in a couple of departments, and then there was even more breakthrough cases in more departments. So as we all know that the vaccine's not 100% effective, and with the breakthrough cases as well, we need to be looking out for the welfare of the employees, and also more importantly, is the people that they interact with on a daily basis. So I would entertain a motion that we vote the mask order in effect and to be administered by the town administrator.
I would like to make a motion that the mask order take effect and be enforced by the town administrator.
Did you have something?
Yeah, I just wanted to, just one thing that we want to, just make sure we are, identifying. Do you want to keep it, for, visitors over the age of 2? I know some towns have done 2, some have done 5. Are you comfortable with?
I'm comfortable with over the age of 2, yeah.
Okay.
Yeah.
Okay. And we would have to identify if you wanted to go into effect immediately or a transition period to have it, we're at Tuesday. Do you want to give a period of time for transition?
I don't know how much time they would need. I mean, I think
Just to get notification out?
The transition is not for those of us that work here.
Right.
We do have masks.
Yeah.
We will provide some masks at the door.
Yeah. And
But I think it's for the public.
yeah, and I think though if we have masks for them at the door, I think that it makes sense.
We do have
Really.
some supply
I
of
know
masks.
the
but-
emergency management folks here in town got a lot of surplus of PPE, so there's
Right.
masks that we can make available for people entering the businesses too. So then I would say immediately.
Immediately? Okay, all right. And I don't know, we do have just the one department head here. I don't know,
Are there any callers on the line that have any questions?
Yes, thank you for allowing me to have a couple of comments here. I did weigh in because I wanted to advocate for the mask mandate and the library director, so I appreciate you voting that in. Thank you. Just a couple of things to consider about the library. We have our walk-in is about 700 people a week now. That's actually low for us, and a lot of them are children. So I was hoping that you would go with the age 2 and older. In addition, we don't serve only people from Auburn. We routinely have people from 12 area towns. So it's not just, necessarily Auburn residents. I know of 2 libraries who somebody did test positive. They had to shut down the libraries because you can potentially put a lot of people at risk. So thank you for, considering this. I just wanted to make sure that if you had any questions, for my department, I would be happy to, discuss any of them.
Oh, good, thank you.
Thank you.
Thank you.
Okay, anything further before we put it to a vote? It's been motioned, and I would make a second for that motion. All those signify by saying aye.
Aye.
Aye. Those opposed? That is voted in. All right,
thank you very much.
thank you. Moving down the director's items, going down to B, the zoning changes proposed for fall meeting.
Sure, so I just wanted to bring to your attention that you do have some zoning changes being proposed for the zoning bylaw changes. In that, we actually have been working closely with Adam Menard, the town planner, Caleb Moody, the building inspector, Amy Contois, animal control officer, myself, and we have some animal changes and clarifications to the bylaw. This actually comes from several years of working with the current bylaw that we've had some challenges. So just wanted to let you know that that is happening. It's actually going through a public process now. Actually this evening, the planning board will be reviewing those, so it's a public meeting. We will also have a pre-town meeting, like an informational meeting that is coming up in October, and it allows anybody to provide, comments or allow questions, us to be able to explain any of the bylaw that people may have a question on.
Okay.
Just wanted to let you know that.
All right, next is tobacco control.
I am thrilled to tell you that we actually, we are in a tobacco grant that Eileen and I were made aware of. And with that grant, we also get compliance inspections. So there have been compliance inspections done through this process. I think I had mentioned to you at a previous meeting that I was concerned that we may have to try to find an inspector, and we actually have it as part of this grant. So some good news to share. Just wanted to let you know we're looking for a report, and hopefully we'll have that in the coming months.
All right. Solid waste?
Update on plastic ban, plastic bag reduction bylaw. That actually goes into effect this Friday, October 1st. And we have, over the past several months, we've been getting notification out to businesses. We actually have our staff going out in person to connect with the businesses. And we've been to a recent Chamber of Commerce meeting to talk about it as well. So just wanted to let you know that is in process. So that's going on.
A West Nile virus update.
Central Mass Mosquito Control has always been responsive to us. We work closely with them, and should we have to do any spraying up until the first hard frost, they will work with us. So just wanted to give you that update.
And then the vaccination bus COVID clinic.
Okay, great news. So we had the Vax bus come to town within the past week and a half or so, and they vaccinated 24 people. Just to put it in perspective, I think that the Vax bus had gone to a large-scale event out in Springfield, and an entire weekend they only vaccinated about that many. So for our event, we did have them in town for 11 to 5. We were thrilled. We actually got a really good turnout. So just wanted to share that good news with you. It was a very positive experience. It was another, again, doesn't sound like a lot of people, but it's another tool that we're using to try to keep interest in vaccinations.
And I don't believe we have any communicable diseases to report.
I don't have the report yet from Michelle.
Okay. And then that's all I have on the agenda for this evening. We'll correspond by email to do the next meeting.
Yeah, that works for you?
Okay, yep.
Wonderful.
All right, so I'd entertain a motion to adjourn.
I'd like to adjourn tonight's meeting of September 28th, 2021.
And I will second that. All those in favor of adjournment signify by saying aye.
Aye.
Aye. Meeting is now adjourned. Thank you.
Thank you.